Assalamualaikum warahmatullahi wabarakatuh. We are going to present to you about our video assignment for PHD311, PHD321. We are from Hospital Al Sultan Abdullah, Hassa. Our group was selected to present on the case study 3. A 30-year-old HIV positive man presented for a follow-up visit. His CD4 plus lymphocyte count was 350 cells over millimeter cube. The normal reading should be more than 500 cells over millimeter cube. A highly active antiretroviral therapy, HAART, was initiated. In this case study, we are asked to explain on 4 different questions, which we already given each of us different workloads to approach using our own interpretation and also creativity. Before we get into the questions part, we first must know what is HIV.
You guys must be wondering, what is a HIV, right? Don't worry, I would like to explain briefly about that. HIV, Human Immunodeficiency Virus, is a virus that attacks the immune system, specifically the T cell, which is crucial for fighting the infections. Over the time, if left untreated, HIV virus can weaken the immune system and leads to AIDS, which is the final state of HIV infection.
The first question will be explained by Ms. Kasdina on what is HAART.
You may have heard the term HAART. So what exactly is highly active antiretroviral therapy, or known as HAART? HAART is a treatment plan that usually consists of 3 or more antiretroviral medication. The other name for HAART is antiretroviral therapy, ART, and combination antiretroviral therapy, CART. The key element of HAART is the co-administration of many medications that prevent viral replication through multiple routes. This way will avoid the spread of a virus that is immune to one treatment. The main indication for this combination medicine is the treatment for people who are infected with HIV-1. There are around 25 different drugs in 6 different classes used to treat HIV. So instead of using one drug, we give 3 or more drugs to make sure this HIV disease can be well controlled.
The second question will be discussed by Ms. Arniza on the main goals of HAART treatment.
First, reduce HIV-related mortality and morbidity. HAART can reduce the number of people who get sick or die from the HIV virus. Second, can improve the quality of life. HAART can improve the quality of life for people who are living with HIV. Third is to prevent HIV transmission. HAART can prevent the spread of HIV by suppressing its virus in people who are infected. And lastly, suppress HIV replication. HAART is a combination of at least 3 drugs that work together to suppress HIV replication. The drugs are chosen to inhibit HIV replication in different ways, so that the virus is less likely to develop resistance towards a single drug.
Then, the third question will be discussed by Ms. Shakira on 3 factors that needs to be considered before initiating HAART.
Hi, I'm Shakira, and today I'll discuss factors to consider before starting HAART treatment. So the 3 key factors are CD4 and viral load counts, drug resistance testing, and also patient's readiness. So first, CD4 and viral load counts. CD4 cells are white blood cells essential for our strong immune system. And HIV destroys these cells, and a normal CD4 count is above 500 cells per millimeter per square. If it falls below 350, the immune system is at risk. Viral load measures the amount of HIV in the blood. High levels indicate rapid replication and weakening immunity. Studying HAART when CD4 is low or viral load is high can prevent further damage. Next is drug resistance testing. This test determines which HIV medications might be ineffective for a person's virus and is done using a blood sample. It's crucial before starting HAART to ensure the right drugs are chosen. So after treatment begins, viral load testing monitors if the medications are working. If not, drug resistance testing is repeated to identify resistance and also guide the adjustment to the regimen. Lastly, patient readiness is critical for HAART success. So this treatment requires strict daily adherence to prevent HIV replication and drug resistance. Missing doses can lead to treatment failure and a weakened immune system. Patients must understand the importance of adherence. Counseling sessions can help them prepare and stay disciplined in following the treatment plan.
And the last one, Ms. Sakina will explain on 3 examples of triple drug regimens commonly used in HAART. I'm Sakina. So now I'm going to give you 3 examples of triple drug regimens most likely used in HAART. The first one is tenofovir disoproxyl fumarates plus with emtricitabine FTC plus with efavirenz EFC. Mechanism of actions of them, the first 2 are nucleoside reverse transcriptase inhibitors or NRTIs, while the third one, which is a non-nucleoside reverse transcriptase inhibitor, also known as an NRTIs. They are commonly used as the first-line therapy and also may cause neuropsychiatric side effects with the efavirenz. So the patient that are using this need to beware of the side effect of neuropsychiatric. The second regime that I would like to share using 3 drugs. The first drug is known as tenofovir alafenamide plus with emtricitabine, and the third one is bictegravir. These 3 drugs have different types of mechanism of action. The first 2 are an NRTIs, while the last one is an INSTI, known for its potency and resistant barrier. So why do I choose this as my second regime? It is because this is one of the newest regimes founded with the most less side effects to be founded. So for my last regime, I would like to suggest using zidovudin plus with lamivudin and also lopinavir or ritonavir. These 3 drugs will be used together, just like the same as another regimes. Zidovudin and lamivudin is a protease inhibitors boosted with ritonavir will enhance its efficacy and will work even better together. However, we need to take notes that these regimes is less commonly used now because of the side effects, and the development of more effective regimes is continuously ongoing through clinical trials. With all due respect, all of the regime that I've shared, this is not a prevention. This is a cure. So, however great our technology nowadays are, prevention is always better than cure.